Our next speaker will be Claire Kamp Dush of the Minnesota Population Center at the University of Minnesota, presenting about family stress and health during the COVID-19 pandemic. Claire, the floor is yours.
Thank you, Megan. Great, just getting my screens set up here with my notes. Okay. So this work is in conjunction today with my co-investigators, so my co-PI, Ann Meyer, and then other members of our team include Rachel Hardiman, Hunjae Kwan, Miranda Berrigan, Katerina Markulides, Wendy Manning, who's a big collaborator of mine on the NCHAT project, and Dave Van Riper, and also Alexander Van Bergen, who isn't on this slide, but has been a big part of our project as well. So today I'm going to be talking about our first aim, which is to examine gender, racial, and ethnic minority and sexual minority disparities in parenting stress and well-being, and related to parent-child relationship quality, and look at the role of marginalization, SES, and adverse childhood experiences. And today we're just really focusing on gender disparities in parenting stress and well-being during the pandemic. So the data that I'm using comes from the National Couples' Health and Time Study, and you may have seen the slide during our break that the data just became publicly available. We were excited. We were emailing with DSDR yesterday that we reached 1,000 downloads. So yay for NCHAT. DSDR is a data sharing for demographic research, and an amazing way to get your data in the public sphere, especially if you have NICHD funding. So shout out to that incredible team that we've really enjoyed working with. So NCHAT is population representative of married and cohabiting couples in the US, age 20 to 60, with oversamples of same-gender couples, sexual minorities, and then I wouldn't say an oversample, but we do have full samples of Asian Americans, Black, and Latinx, Latina, Hispanic, Latino, and Latina individuals. Our survey was gender neutral and inclusive. That was collected in Spanish and English, and it's a multi-method survey. So we have the main survey data from 3,642 main respondents and time diary data from about 1,900 main respondents. That's modeled off the American Time Use Survey. All of our data was collected during the pandemic. I saw in the chat, we were thinking and laughing about how, when COVID first hit, we thought it was going to be over in like 2 weeks. And I remember I was packing everything up and getting ready to move to Minnesota. And I kept thinking, the kids will be back in school soon. And that didn't happen. And so we were just getting ready to launch NCHAT whenever everything hit. And we pivoted pretty quickly to edit our survey to ask about COVID and COVID-19 and the context of the pandemic. And we also asked about racial trauma related to George Floyd's murder. So some of those are some of the events of 2020 that we revised our survey to kind of address. And little did we know when we got in the field in September of 2020 that we were kind of stressed out. Like we thought, we need to make sure we get all these data before everything opens back up, and we introduce, additional period effects to what is already a large period effect. And then, that wasn't an issue. We were out of the field in April 2021. So that is the data, and main survey data is now publicly available and also available in the virtual data enclave, where you can get a fuller version of the data. Okay, so for our first research question that we wanted to talk about, which is how did men and women in different and same gender relationships spend time on paid work, housework, and childcare during the pandemic? And I know I've seen lots of stories about this topic. There was like a line that you could call in. I think the New York Times sponsored it, where people were just like screaming in frustration, women in particular. So this was something that was very salient to a lot of folks during the pandemic. And so for this paper, we're looking at different types of couples. So we have men in different gender relationships, women in different gender relationships, men in same gender relationships, and women in same gender relationships. And this is excluding folks who are non-binary or not in this analysis. We do have folks in those categories as well in NCHAT, but they're not in this analysis because it's kind of focused on gender. Our dependent variables were from our time diary data. And we had paid work, such as working or attending a work event or checking work or emails or messages, housework, including cooking, doing laundry, doing home improvement, paying bills, and childcare, including playing with a child and driving a child. And we have a smaller sample size for those childcare variables. and because not everybody was a parent. And then our covariates include couples education, couples employment, the work location, marital status, parental status, and race. So just to give you an overall picture of how much time people were spending in these categories, on average, we had men in different gender couples and men in same gender couples spending similar amounts of time in housework. But women in different gender and in same gender couples were spending more time in housework. In terms of paid work, men in different gender couples, just in the raw data, had the highest levels of paid work, whereas women in different gender couples had the lowest, which I think is based on what we would expect, based on the literature in terms of the gender, housework and paid work are still very gendered in the United States, even with the gains women have made in terms of their education, and even with the gains that women have made in terms of their employment. So here you can see that in terms of time spent in childcare, we combined our men and women in same gender couples in this analysis because of our smaller sample size. But you can see that women in different gender couples were definitely spending more time in childcare than men in different gender couples. Even in this context where a lot of folks were both working at home. And overall, we found that here are the negative binomial regression results, and because these are zero inflated variables. And what you can see here is that women in different gender couples spent about 2.43 times as much time on childcare than men in different gender couples. And that number was even higher for men and women in same gender couples. You can also see the amount of time spent on housework and paid work here. And these models do include the covariates, I should mention that. And here you can see that women in different gender couples spent less time on paid work than men in different gender couples. And women in same gender couples also spent less time on paid work than men in different gender couples. And for housework, only women in different gender couples spent more time on housework than men in different gender couples. So that suggests that gender is playing a role in terms of how people are spending their time during the pandemic. There's been some literature that suggested that maybe there was some more equality in terms of time spent in housework and childcare and paid work during the pandemic, but a lot of those data are based on self-report data, which tend to not be as reliable. And you have to count for every minute of the day. It's a little bit harder to be biased in your estimates of how you're spending your time. Now, in this last panel, the time spent in paid work, you can see that men in same gender couples, they were the referent group. And even in that situation, you can see women in different gender couples still spent more time. And we've done some additional analyses on these. And really the major point and the major take-home message of this is that women in different gender couples were particularly disadvantaged in their time in housework and childcare, and spending less time in paid work during the pandemic. And I think a really important, interesting question for all of us to consider is what are the long-term implications for women's career trajectories when they are in different gender couples in terms of how the pandemic, women left the labor force. We know some of that from Ann Meyer's work. So what are the long-term implications of this for women's career trajectories? For our second question, we wanted to look at dual earner couples. And now, a lot of dual earner couples tend to have more egalitarian ideals about housework and childcare. And, especially among those that are more highly educated, there's a lot of endorsement that fathers should be highly involved. We see this everywhere in just even watching TV shows, so many baby showers now are couple showers. So you just see that fathers are expected to be involved. So here we're looking at how are housework, childcare, and household planning management stress associated with depressive symptoms and anxiety among those dual earner couples that ideally would have a more egalitarian division of labor because everybody has a job. And so our predictors here were housework stress, childcare stress, which is how stressed are you about the following. And then this more unique measure, that's one of the first studies to examine this, especially in a population data set, which is that household planning and management stress. So for me, it's I order my groceries online and I just really hate doing that every single Sunday morning. And because I have so many children that they eat a lot of food and it just takes me a while. So that would be that kind of planning and management stress. That's just annoying things, but it's not exactly housework. But it's more that just, figuring out, my husband was trying to figure out who has practices when and making sure all the kids get to all their things. Some of the covariates we have here are working from home, distance education, race, couple gender composition, marital status, age, education, employment, number of kids in the household, child ages, caring for another family member, household income, and survey month, because we do tend to include survey month in these analyses due to the variability of the pandemic. And then we're looking at the short form of the CSD and anxiety as our outcomes here. And I forgot to mention that we do have a subsample of analyses of parents with a school-age child, because of the unique stress potentially of that distance education. We didn't have a good measure in the study, and this is something I would include if we could go back to September, of childcare closures and people reporting that their childcare was closed. But we did limit it to those school-age children because we were able to examine that. Okay, so in general, I'm sure if you're familiar with this literature, this won't be surprising to you, but women did report more housework stress, childcare stress, and household planning and management stress in each of these domains than men did. And this was associated with mental health. And I think this is important for us to think about as we, we know that parental mental health impacts child development. We know that when mothers are depressed, children's, development is impacted and socio-emotional development can be impacted. And so it's important to consider how, parents' mental health is associated with these division of labor. And so you see here that for women in particular, when that they did report more depressive symptoms than men did during the pandemic, and anxiety than men did. Though we do know from, that women tend to endorse these more in general, so that's not unique to the pandemic. But when we look at the predictors for depressive symptoms, and this also includes all those covariates, what you'll see is in our regression results that housework stress for women in particular was associated with more depressive symptoms. And for men, household planning and management stress was associated with more depressive symptoms, which I think is interesting to consider. In terms of anxiety for women, that housework stress again was associated with more anxious symptoms. And for men, we found that none of the division of labor stress was associated with anxiety. For depressive symptoms, we found that having more housework stress and more household planning and management stress for that subsample of people that had school-age children, those are both associated with more depressive symptoms. So for parents of school-age children, that household planning and management becomes significant when we limit it to that sample. And maybe that's trying to get a child on a Zoom meeting if they're doing distance education, or figuring out that, do they have the masks if they're going to in-person school, if they are masking at school. For men, again, that household planning and management in that subsample was again significant for depressive symptoms. And then for anxious symptoms, we find that each of the sources of stress for women was significant for that sample that had school-age children. So housework stress, childcare stress, and household planning and management stress were all associated with more anxiety. And for men, it was the childcare stress for anxiety that was associated with more anxiety for that sample of men with school-age children. So again, that makes sense, having to hop off of a Zoom because you're helping your child with, some kind of login or whatever they're supposed to be doing. Oh, I only have 3 minutes left. So I'm just going to say my implications. Overall, beyond numerous contextual and demographic controls, we found that unpaid division of labor stress was associated with lower well-being, and the association between childcare stress and well-being for parents with a school-age child may be unique in the context of the pandemic. And I really quickly just wanted to mention that thanks to the U01, we also have coming soon in early 2023, we're working on structural racism measures by county in the US based on the ACS 5-year data from 2015 to 2019. We have coded structural sexism measures that we're going to be distributing. And we are also working on measures of structural cis heterosexism. And all of this is thanks to funding from NICHD. So I just want to wrap up by thanking all of the support we've had from NICHD for this U01 and for the NCHAP project in general. And we've had additional support from the Office of the Director and NIMHD as well. And thank you very much.